Recent statistics shows that back pain is the second most reason for visiting medical doctors. It is also the leading cause of disability among people under 45 years of age. There are many causes of backache. It could be poor posture, sedentary lifestyle, injuries, muscle imbalances, that could be muscle weakness or muscle tightness, stress, the way we use our bodies in our day-to-day life, and in rare cases, some serious diseases. Yoga helps back pain by releasing stress, by correcting body posture, by correcting the muscle imbalances, that is, by strengthening the weaker muscles, and by stretching the muscles which are tight, and by creating body awareness. Today, I will demonstrate 10 yogic postures which will be highly beneficial for people suffering from backache. Before performing these postures, I recommend you all to consult your physician, your medical doctor, and to ascertain the cause of backache and then proceed with these postures. This posture is cat posture. Here you have to exhale and come to this position. See, you are arching your body, your lumbar region, the waist region. You are arching. Now inhale and you have to round up your back. In this way, you have to repeat these steps for 10 to 20 times as far as you feel comfortable. Now coming to the second posture. Here you have to twist your body, raise your left arm like this and stretch your body. While raising it, you inhale, hold there, exhale, come back, again inhale and raise your right hand up. Look towards the raised hand. In this way, you repeat it for 3 to 5 times. There should not be any holding of the breath. You should take breath comfortably. Next posture, exhale and look towards your left ankle. Here you are bending your trunk. Inhale, come back, and now exhale and go to the other side. Look at your right ankle. In this way, you have to repeat it for 3 to 5 times. A variation of Bhujangasana. You have to exhale and raise your body up, hold in this position, normal breathing. This exercise will strengthen your lower back as well as it mobilizes your mid back. Relax like this after doing this, and you can repeat this for 3 times. After resting for a while, take this position, keep your arms like this, and then exhale completely and raise your upper body. This position will strengthen your upper back muscles, that is the muscles at the back side between your both shoulders. We call it interscapular muscles. It will strengthen these muscles. Relax. Perform it again for 3 times. Relax. In this variation of cobra posture, you stretch your arms forward, exhale completely and raise it. Do not raise your legs, keep the legs resting on the floor. This exercise will strengthen your muscles, back muscles on both sides of your spinal column. And relax. Repeat it for 2 times. Now we will go for back muscle stretching. For some, the backache is because of the too much tightness of the back muscle. In this, you keep your right leg over your left, twist it towards your left side and look towards your right side, and make sure that both of your shoulders are touching the floor. It is very important that both the shoulders are touching on the floor. Come back. Now interchange the legs position. Keep your left leg over your right leg and twist towards your right side and look towards your left side, and make sure that your left shoulder is touching on the floor. Repeat this for 3 times. You can relax in Shavasana, and then we will proceed for another stretching. For most of the people, lower backache is because of the tightening of the outer hip muscle. Now we will stretch the outer hip muscle. We'll keep your left foot over your right knee, and with your hands pull your right knee towards your body. In this way, you will feel a stretch on the left outer hip. Now you repeat it with the other side. You just see the form. It should be correct, otherwise you will not feel the stretch. Keep your right feet near your left knee. Take your right hand from in between your both legs and the other hand by the other side, and pull your left knee towards your body. You will feel the stretch. Now relax in Shavasana. Now we will perform Trikonasana or triangle pose. Here keep 3 to 4 feet gap between your both legs. Come to this posture and bend like this. Place your left hand by the back of your left feet. Look at the raised arm. Perform to the other side. Please note the position of the feet. It has to be like this. This asana stretches your lower back as well as hip muscles and relieves backache for those having stiff low back or hip muscles. For beginners or those who are having problem with doing this Trikonasana, they can do the same with the help of a chair like this. You have to keep a chair in this form and perform at both the sides. This asana is highly recommended for people suffering from backache with stiff low back or stiff hip muscles. Do this Trikonasana for 2 times on both the side. Now another variation of Trikonasana. Here the same way you will go, but instead of your left hand, now you will place your right hand at the back of your left feet. So this is slightly advanced, and those who can do Trikonasana comfortably, they can do this asana also, and this will also help them further. You can repeat this asana for 2 times on both the sides. In the same manner, those who are having problem, they can do this asana with the help of a chair on both the sides. Make sure that your legs are straight while doing Trikonasana or the variation of Trikonasana. Now the next asana is Balasana. Sit in this posture. Slowly exhale and bend down. Your hips must be touching your heels. Your forehead touching on the floor. Relax. As you see, you are rounding up your lower back or the lumbar region, and it gives a good stretching to your lumbar region. While coming out, come out in this form, come to kneeling posture, and then slowly release your legs and come to long sitting posture. See from the back portion how to keep your legs. Your big toes are together and your heels are separated. You are forming a cup shape with your feet, and see the way I am keeping my hands and then lying down. This is the posture of Balasana. In this posture, you will be moving your lower back, lower arch. This is a very relaxing posture. Usually you have an arch at your lower back so that you can put your hand under that. We call this area lumbar area. And here we are going to flatten this lumbar area by pushing on the wall like this with your legs in this position. You push with your legs on the wall. When you push, you will flatten your lumbar area, that you cannot enter your hand now. It's flattened. And when you release pressure from the wall, your lumbar arch is again formed. That means you can place your hand under your lumbar area. So in this way you can you can form lumbar arch and then flatten it. Those who have more flexibility in their lower back, they tend to stand like this. See, protruding, abdomen protruding forward and more lower arch. So this will also generate low back pain. In this you have to consciously, you have to pull your abdomen under, pull your abdomen towards your spinal column, and you have to stand straight. While having low back ache, lying down with these pillows and bolsters will also help you to relieve low back ache. You have to keep a bolster, a folded bed sheet, and a pillow of your size. That means your spinal column should be in the straight line. Pillow should not be big, should not be too small. Now you have to adjust like this. Keep the bolster under your knees. Keep the pillows so that your arch at your cervical region at the back of your neck is in one line. The spinal column is in one line. Keep the folded bed sheet so that your heels lands on the folded bed sheet. So when you lie down like this, what happens is your lower arch is flattened and you relaxes your lower back. So if there is any sudden pain when you lie down in this way, it will give a big relaxation to your lower back. Practice these asanas for 10 days and see the result by yourself. If you have any queries, any questions, please post your comment and I will be there to help you. So thank you once again for the patient watching. Thanks.